World Hearing Day is celebrated annually. It's a day when we get to recognize the importance of hearing, but it's also a day that reminds us that we need to be looking at hearing throughout the year. It's insufficient to only be thinking about our hearing one day a year, but the World Hearing Day gives us that opportunity to highlight hearing, to highlight the importance of ear and hearing care. And this year, the World Hearing Day takes an extra flavor because it's the launch of the first World Report on Hearing. It's a report that was commissioned by the World Health Organization to look at the hearing situation in the world, the number of people with hearing difficulties, the degrees of difficulty, but also the socioeconomic as well as the other impacts of deafness. And so World Hearing Day is an opportunity for us to highlight those important aspects about hearing, promoting healthy hearing, promoting a healthy hearing lifestyle, safe listening, all of these things that have to do with our hearing that we often take for granted. World Hearing Day gives us an opportunity to recognize them and then remember that we have to practice that throughout the year. There are different reasons for deafness. Some people may be born with deafness, and those can be congenital reasons due to complications in pregnancy, complications in birth. Sometimes some deafnesses are hereditary, they pass on in families. Other people develop hearing loss in their lives. Some people may develop it, for example, after a serious illness. Measles or meningitis can leave lasting effects on hearing, mumps for example. And in South Africa, a big issue has been issues around ototoxicity. So for example, people in the past, in receiving some very strong medication, for example around our high numbers of tuberculosis, there could be some ramifications for hearing. So there are very many causes. There are also some that are more permanent and some that are more transient. So for example, there are many children who develop temporary hearing losses. There may be conductive hearing losses due to an infection in the ears, and that's quite common, and it can be addressed through medical intervention. Some people have more long-term hearing difficulties, and so we may need to look at hearing aids and other assistive listening devices. Some people may be candidates for cochlear implants. Other people use bone-conducted hearing aids or bone-anchored hearing aids. There are a variety of interventions and services for people with ear and hearing problems. Some of them medical, some of them rehabilitative, but spanning across the lifespan. There are also some lifestyle factors that can have an influence on hearing and can affect hearing. So for example, excessive noise, listening to music at very loud levels. Some concerts can be exceedingly loud, going to very noisy places, so some nightclubs. So it's very important to keep in mind that when we are going to these noisy places, that we need to keep our ears and our hearing in the foreground of our thinking. And so it's important to be protective of our hearing. So when listening to music in headphones, for example, make sure that the noise levels, the sound levels are not too high. Because very many times you'll see people walking past and from quite a distance you can hear that other person's music. And that's already an indication that that music is too loud even for that person. So be very careful with the settings on your earphones, on your headsets, being very careful about your exposure to noise recreationally. And so it's also important to think about some of the other things that we don't always think about. So ear and hearing care, being sure that your ears are looked after properly. So when you clean your ears, for example, some people have the tendency to use cotton buds and go quite deep in the ear. Well, cotton buds shouldn't be used in the ear like that. They should only really be used to clean the outside of the ear. The ear canal itself can clean itself. And so we should only be using maybe a damp cloth to clean the outside of the ear, or an earbud or a cotton bud to clean the outside of the ear, not pushing the wax down the ear canal, which can happen. And if you have got any concerns about ear or hearing, for example, if there's a wax impaction. And so for some people that is an issue where wax builds up. But using a cotton bud only pushes that wax deeper down the ear, and then the wax can't get out naturally. Then see an audiologist, or see a doctor, or see an ENT to get that wax removed. But generally, if you have got concerns about your ear or your hearing, please see an audiologist, see the doctor, get a referral to the clinic to make sure that the difficulty that you notice now doesn't increase and become a greater difficulty over time. If hearing loss goes unattended, unaddressed, undiagnosed, there are opportunities for some difficulties and challenges. Very many people with deafness may choose to have hearing aids fitted. Some people choose to use sign language and communicate via sign language. So there are different options for communication, but for many people with deafness, communication is a major impairment. People miss out on hearing what others are saying, but also may be excluded from conversations because they're not able to hear. They may not be included in decisions. There may be a general difficulty in communication, especially if the person communicating with the deaf person doesn't use a mode of communication that is accessible to the person who's deaf. Or if people do not attend to any ear disease, there can be further complications. So for example, there are some ear conditions which start off quite small in the ear, but if they are left untreated, those infections can leave long-lasting effects and other conditions. And so we need to be very careful to attend to ear health issues very early on. Similarly, in the past, there have been delays in the identification of deafness in children and in older people, but this late identification has impacts on language development, speech development, maybe even educational and vocational impacts. Getting to the bottom of the difficulty means that decisions can be made about where to go, looking at options around amplification such as hearing aids, looking at language, for example sign language or special needs school, so looking at different opportunities for attending to the ear and hearing difficulties. If there are concerns about hearing, it's best to attend to those concerns very early on. So parents, if there are concerns about the child's hearing, or there are delays or concerns about the child's speech and language development, it's best to make an appointment to have that checked. You can also check at home, see how the child responds to the name being called or respond to sounds in the background. But many children don't respond to those, even children who don't have hearing difficulties. So to be sure, it's best to make an appointment to have the hearing checked. Adults who are having any difficulties hearing are also encouraged to see an audiologist, to have the hearing assessed, to check the level of hearing. And for some people, it's important to monitor that hearing. So to check the hearing at regular intervals, a year or every 2 years, so that we can check to see if there are changes in hearing and if the hearing starts dropping, so that early intervention can be offered. And again, an appointment can be made at the audiologist. There are some online assessments that are on offer, but we also ask people to interpret those with caution, because there are some that are maybe better than others, and it's not a full diagnostic assessment, but there are some others. So for example, if you visit the World Health Organization site, there are some opportunities there where they can give you some guidelines about what to do if you want to check your hearing at home. But I'd suggest checking with the audiologist and having a hearing assessment done, where we check the outer ear, the inner ear, and we see how the sound travels up to the brain to give us an indication of their hearing ability. The Department of Speech Pathology and Audiology at WITS is the oldest department of its type in the country. And in the audiology section, there is the speech and hearing clinic where we do hearing assessments. We are able to see people from very young children to elderly people, diagnosing and assessing for a range of different hearing difficulties. We not only assess hearing here, but we also look at people with balance difficulties, as well as maybe scholastic difficulties, and a range of issues related to hearing. The speech and hearing clinic is open to the public. People are encouraged to make an appointment with the clinic secretary, and then an appointment is scheduled. The students see the client under supervision of one of the members of staff in the department. So it is an opportunity for students to learn and for students to get a lot of insight into the practice of audiology. But it's also an opportunity for members of the public, the university community, anybody to make an appointment at the clinic and to have their hearing seen and the hearing assessed. The services of the speech and hearing clinic here at WITS are open to the public, not only the university community. And if people want to come for assessment or even services for ear and hearing care difficulties, then an appointment can be made by accessing the contact details below and to make an appointment here at the speech and hearing clinic.